Morning, everyone. I'm really thankful for the scientific committee for giving me this opportunity to speak on a topic which is very close to my heart, that is ROP. And for the last few years, most of my presentations have been on ROP only in various conferences. I hope I'm able to justify this presentation that I'm about to make. And यार शुरू से करो ना slide 2. So what are the challenges? Before I really, tell you about the alarming numbers, I would like to tell you what are the challenges in this ROP treatments that we are facing. That today in India, we are fighting an epidemic, which is the third epidemic of ROP, but with a very limited number of warriors. The number of ophthalmologists who are dealing with this disease are too few, and the number of disease of the patients is too high. And we have poor quality of neonatal services in tier 2 and tier 3 cities, which is adding fuel to the fire. Then there are social barriers to the treatment, what I call is a Sasuma syndrome, because once you diagnose the child as having a ROP, the daughter-in-law, she goes back home and tells that child is affected by this disease. The mother-in-law says, no, do you know better than me? You have got one child and I have produced 5 children. So I know better. This child doesn't have anything. You just sit home. Then there are economic barriers for treatment and the fear of litigation, as Dr. Nishant was saying, fear of litigation and humongous compensations which are being given, so ophthalmologists are shying away from ROP. The aim of this presentation is to motivate the young blood sitting here in this room to fight against this childhood blindness. In the current scenario, as I've already told you, the burden of the disease is too high and the number of specialists is too low. And the services required is acute in tier 3 towns and cities, because you have a lot of eye specialists and ROP specialists in bigger cities and metro cities. And ophthalmic services have not kept pace with the neonatal services. You can see the mushroom growth of neonatal centers in each nook and corner of the India, but our younger colleagues of ophthalmology, they are not doing ROP screening. We need more people who can screen, little lesser who can do laser, and much lesser who can do surgery. If the first two are met with, believe me, the number of surgeries would be too less. See, this is a NICU, which is, I would say, a world-class NICU, and this is in a tier 3 town of Kapoor. So this is what I'm trying to tell you, that NICU services have expanded, but ophthalmic services have not expanded. All the ophthalmologists are trying to concentrate is cataract, motiabind. And it's very shameful that 1/4 of world's blind children are in India. And these kids, they are sentenced to a lifelong, sentence of darkness for 60 to 70 years of their life. It is a humongous socioeconomic burden on the country. And half of these blind children, they die in low economic LIC countries. And even those who survive, they have impaired development and cognitive abilities. India also has a dubious reputation of highest number of preterm births, which is 3.5 million per year. And this preterm is less than 37 weeks of gestation age. And various studies in India have reported the prevalence of any stage of ROP between 20 and 40%. So you can imagine when you multiply this with 3.5 million, what will happen. So there was this one paper published long time back in IGO by Vinegar et al. They had extrapolated the figures from few other states to Punjab, and look, and the current present estimate that I have done is below, that because though the population is higher now as compared to their study, the crude birth rate has come down, the number of live births has come down, infant mortality rate has come down, so the survivors were less. However, in the next slide you see, they had calculated that at-risk babies were 3%. According to my estimate of 4%, because by the National Family Health Survey, at least 4% would be less than 2,000 grams, which is a cutoff for the ROP screening. 75, they have told admission of 40%, but right now, because of a Ayushman Bharat scheme, the admission rate to the NICU is 75% or even more. So hence, by doing all the calculations, their study told the number of treatable children in per year in Punjab would be 36. So Dr. Nishant would be here and Dr. Dinesh is here. They can very well, agree with me that this number is a joke. So according to my estimate, this number is about more than 1,000. See, this is my own data, and this is a retrospective analysis. And here from 2019 to 2023 in 2 centers, I mean not 2 centers, actually in 2 areas, I have screened 1991 babies, out of which 3% or 61 babies were lost to follow after first visit. So we are having 1930 for calculations, out of which 1,102 babies had any stage of ROPs, which is 57%. As I already told you, the literature says 20 to 40% in India, but my area has higher ROP, and out of which again few were lost to follow up. Then treatment requiring babies are 455, which is 23% of the babies screened. Again, a very high number. We could treat only 363 out of this, which is 80%. Even if somebody, a few sitting in the hall thinks that maybe I'm over treating, I'm over diagnosing, then look here, it's the same person who is doing, but in Ludhiana when I am doing, here you have any stage of ROP which is 20% comparable to the published literature, and treatable is 7%, again comparable to the published literature. It's that area where the neonatal services are poor, the numbers are bound to be high. Again, this is a retrospective analysis for the treatments done, and look, the AP ROP and hybrid ROP amongst my babies is very high, which is not a usual feature in other published cohorts, even in ET ROP. And this is again pointing towards very poor neonatal services. This is treatment outcome that we could successfully treat 97% of babies in spite of the babies having very severe ROP. So to conclude, the state of Punjab and India has much higher number of babies requiring ROP screening and much higher incidence of treatable ROP than believed and published. And we need more young people to carry on this war against childhood blindness. AROP and hybrid is seen more commonly, which is quite different from ETROP or other cohorts. And as per me, with a little modification in ETROP, if we treat a little bit more early, we can have very good outcomes even with severe forms of ROP. And once, this is to motivate the young blood, that once you start doing ROP screening and treatments, you will, I'm saying, now you are searching for patients of Motiabin, then the patients will be searching for you, and your name and fame and popularity is going to soar and increase rapidly. So take up this fight against blindness, and don't be disheartened, because koshish karne walon ki kabhi haar nahi hoti. And I am here to teach this art and science to anyone who is interested. Thank you very much.
Thank you, Dr. Ajay. I think that's a very important message for everybody. And I think it should not be restricted to retina specialists doing screening only. No, I think everybody can, and everybody and anybody and everybody who is interested in learning how to do a screening should not shy away just because there have been some adverse code.
See, screening is the backbone cases of ROP. In my series, stage 5 and stage 4 numbers are so low that it's all because they were screened and we never allowed the children to reach stage 5.
I was actually astonished at like it doesn't even form in some big institutes. The pediatric ophthalmology fellowship also does not constitute a ROP screening program. So I think pediatric ophthalmology fellows should at least be part of a screening program.
Exactly.
Most of us doing screenings, I've been doing it for more than 25 years now, like are not doing the surgical part of it. But by screening early and by doing medical treatment, we are able to reduce the burden to quite a bit, and then there are only few cases which need to be referred, and they are at least under your supervision.
Exactly.
So we can take care of this. The only motivation, as the last wordings by Ajay Kapoor, koshish karne walon ki kabhi haar nahi hoti.
Thank you, sir.
Thank you, Dr. Ajay.